There are four major types of MS, with the one type, relapsing remitting, the most common, where people can live relatively normal lives. They have periods of flare-ups where they have reduced function, followed by periods of remission where they're pretty much normal. So that's the most common. You can see is 85%. Primary progressive gets worse over time, no remission, but the rate of progression varies among people. So some people it's going to be a very sudden progression, other people it's going to be more long term. A secondary progressive is when the relapsing remitting turns more progressive, and then a progressive relapsing, so a steady worsening from the onset, and people very quickly deteriorate. There are lots of medications, and if you look at the National Multiple Sclerosis Society webpage, there is a very long list of medications that people can take for MS and some of the various other conditions with it. A lot of the medications try to slow the disease process themselves. All of these medications often have many serious side effects, so they may not always work for people for a longer term, so they may have to change medications. Interferons, and those are used sometimes in cancer treatment. The most common brand name is something called Rebif, which can cause flu-like symptoms. Glatramine acetate or Copaxone is the brand name, can get irritation, so these are injectables. So if a person has to travel, you have to fly, then you have to travel with these. It's it can be very difficult. Mitoxantrone, Novantone. So once again, fever, chills, flu-like symptoms. There is a drug called Simetril, or amantadine is a generic name, which can help reduce the fatigue, that flu-like symptom like fatigue. Prednisone is also used. You can see it's been used in many chronic illnesses, but it does cause muscle wasting and osteoporosis and all those other effects that we have talked about. And interestingly, for when people develop spasticity in their muscles, they can actually have Botox that's used. People may also be taking, medications for anxiety and depression, along with a lot of these. So, like I said, there's a long list of medications that can be used in, primary and secondary treatments in MS. Exercise testing. So people tend to do better in the morning. Their disease is less bothersome to them. Balance issues can be a problem. The cycle ergometer is probably going to be better over the treadmill. You might have to use toe clips. The 6-minute walk test is also going to be good if they're able to do that. You can monitor their heart rate and blood pressure. They may not reach 100% of their max, but they could get pretty close to their max heart rate. If you are in a rehab center and you have access to an isokinetic machine such as a Biodex, you could do that, or else you could do a 10 RM versus a 1 RM assessment. So the number of repetitions, the amount of weight they can do for 10 repetitions. Sit and reach, but probably actually using goniometer and getting an angle of flexibility is probably going to be better with this type of population. Neuromuscular assessments, balance, gait, fatigue scales are something that you can definitely do with this population. Exercise training, if you look at the case study in the Chronic Disease and Disability text, they have a very good example of a program for MS. Cycling is excellent. A lot of people with MS do really quite fabulously cycling, walking. They do great in the pool. Resistance training, they can definitely do that. The student who had the friend with MS said that, her friend really had no problems exercising. She could really exercise like a normal person. Flexibility may help reduce spasticity. And along with cycling, the Multiple Sclerosis Society, they do their 150-mile bike tour fundraisers, and so they have a lot of people with MS that participate in that. And I believe that's done in the fall in South Carolina.